cardiac center because we have the tools here to do it. And anybody who comes off island from any part of the world, you'll be able to pick from wonderful hotels that we have here. So I'd like to let you all know that we have some sponsors, and where we like to let you know that drugstore.com and eHealth Insurance are one of the reasons why that health channel is up and running and moving along so wonderfully. And soon we most likely will have the Caribbean Kidney Center as one of our sponsors, so we'll be talking with him soon about that too. Hey Walter, you back with us?
I'm with you, my friend.
Okay,
All
good.
right.
No worry. In everything we got technical difficulties, and you know that's why we got, what do you call them machines when your heart stop? Well,
You got me there.
well,
What?
I don't want to get between you and
I don't
Shonda.
know what he talking about. Hard stop, right, Dr. Gardner?
I'm not going there.
Anyway, Walter, we got about 7 minutes, and I want to really take advantage of the time. And we have to continue on the dialysis part. But before we get into that, I really want to thank you and the Caribbean Kidney Center for being part of this radio show. And we're going to have to see how we could develop a continuing segment, a few minutes, even if we have to pre-record it, to keep advising our dialysis patients and those other individuals who are walking the streets do not knowing that they might be coming along to your center soon.
Right.
So could you just, I know we were interrupted with that technical difficulty there, but please continue that train of thought that you had.
Well, I would also like to thank you Tito, and your co-host, your lovely co-host.
You love to say that word lovely.
I would like to thank you guys for having me on the show today. It's always a pleasure to be with you and to be able to educate the public. I love to take every opportunity I have to do that. And let me kind of summarize what we talked about today. CKD, chronic kidney disease, is a common problem, complicating hypertension and diabetes especially, but there are other forms, there are other causes of CKD. We here at the Virgin Islands are fortunate to have a group of well-educated, good, effective nephrologists. I won't name names simply because I don't want to be promoting necessarily, but you all know who they are. They are all excellent nephrologists. They all work at the kidney center, quite frankly. They all have patients at our facility, and they are part of our success story as well. I want to emphasize that the objective that we have and we aspire to as physicians at the Kidney Center is to empower our patients with education of the disease process so that they can, with our direction, manage their disease process well and effectively, and as a result of that, to live long and healthy lives, despite the fact they're on dialysis. And to that end, let me also suggest that a significant portion of our patients, we have a full shift of patients every day who are actually continuing full employment, so that the kidney disease is not necessarily totally disabling in most patients. That with compliance, with education, and with doing the things that you're supposed to do, you can live a full and healthy life. We also want to suggest, I neglected to mention that we have a very active transplant program at our facility as well. Mm-hmm. We are being an independent facility. We can and do affiliate with a variety of different hospitals across the United States and Puerto Rico, and we refer patients to these facilities for transplants regularly. We've had two transplants so far this year. One was performed in Miami, the other one was performed in Dallas. The Dallas transplant patient had a kidney, pancreas transplant, and they're both doing exceptionally well. We also have affiliation with several other hospitals in the States and Puerto Rico, so that we have a very active transplant program. And as you know, transplant is the only cure end-stage disease.
Yes.
Well, Walter, you know,
Pleasure talking to you guys, and I want to thank you again for having me on.
I just want to let you know, Walter, you know, I always remember something that Dr. Randall Nicholas James used to say. When you got to go, you got to go. But before we go, we want to thank you, and we want to thank our sponsors, and we would like to welcome the audience to tune in every Saturday to Heartbeat here on www.kalalu.com on the Health Channel. And if you scroll down, you'll be able to hear audio there live. And we will continue, we'll be announcing in the week after the Vibrant Health Show that we'll be broadcasting on Wednesday from 10 to 11. And we will be doing that here now. So Sherry, you can say the last few words.
I want to thank Dr. Gardner. It's always a pleasure, talking with you. And again, there's so much more information that I don't know about renal disease, and I'm looking forward to continuing this talk with you and also doing a continuing education seminar regarding chronic disease. So thank you again. See you in the halls. And again, I'd like to thank Tito and Anthony Weeks for Kalalu.com for having us, every Saturday here, starting at 10. Again, we need to let you know that we start at 10, and it's not accident, Tito, that people log on. By them knowing, they will see what we're going to give to them by our education.
I thank you, Sherry, for being my co-host and co-producer of this program. And we thank our executive producer, Mr. Anthony Weeks, for carrying us through. You are on Heartbeat, the radio program of selection of health discussions here on Kalalu.com. You will be tuned in next Wednesday here for Vibrant Health, where you will have Dr. Robert Centeno and Ms. Sholanda Simmons Emmanuel on Wednesday at 10 to 11 here on Kalalu.com. Ladies and gentlemen,
today's show is rebroadcast.
And today's show will be rebroadcast on the health channel on Kalalu.com as we move along, so you'll be able to listen to us and enjoy the wonderful voice of Sherry and those words of precious words from Dr. Gardner, loving Sherry. Okay. Walter, take care and see you in the hallways.
That's our thing.
Thank you.
Take care.
Thank you.